Do you know your Medicare rights? Hi, this is Kathy Bukowski. I'm the owner of CB Health Insurance, and this is the CB Health Insurance YouTube channel. Welcome to today's videos. Do you know your Medicare rights? And if not, stick around because we're going to tell you what they are, and you should be aware of them. Hi, I'm Kathy Bukowski. I'm the owner of CB Health Insurance and the YouTube channel CB Health Insurance. And if you are new to our channel, please be sure to subscribe, hit the little subscribe, and hit the little bell so you get future notices of when we release videos. It's about 2 times a month. So be sure to give us a thumbs up, tell your family and friends, and hope you enjoy this video. Now, on to today's video. Do you know your Medicare rights? What are your Medicare rights? Anybody that's on Medicare, A, B, C, D, the whole alphabet soup of Medicare alphabet, actually you can't be on all 4, A, B, C, and D. You can have original Medicare A and B and a Part D drug card, or you have to be enrolled in original Medicare A and B, and you can be on a Medicare Advantage plan, but you can't have all 4. But there are rights for all Medicare recipients. What are those? There's also rights for people who are on original Medicare. There are specific rights for that. There are specific rights for those people enrolled in a Medicare Advantage plan. There are specific rights for those people in a PDP, a standalone prescription drug, otherwise known as Medicare Part D. So what are these, and how can I get more information? If you stick around to the end, I'm going to give you a free report on this. So first of all, let's talk about Medicare for everybody. You know, anybody that's enrolled in Medicare, what are your rights? There's probably about a dozen, about 12 to 13 that the government actually lists out. I'm going to cover a few. But one is that you are treated with dignity and respect, and that you are not discriminated against, and that you get your information provided to you in a language and in a way that you can understand it. There are many languages in this country. Not everybody speaks English really well, and so they do provide that in a way that you can understand it or have access to somebody that can explain it to you. Also, having access, that leads me to another right, to having access to care. That's one of your rights, as well as if you don't agree with the way a claim is paid, you could always appeal it, and you can file a complaint about a provider, about Medicare. So those are just some of your rights under anybody that's under Medicare. So whether you're on A, B, and D, or you're on A, B, and C, that's provided to everybody. Now, let's talk about those people that are on what we call original Medicare A and B, where Medicare is your primary. There are some rights specific to original Medicare, and one of them is that you can see any doctor or provider in the country that participates in Medicare. You are not limited. You can go anywhere in the country if you're on original Medicare and that's your primary, and really seek care from anybody that participates in Medicare. So that's a big one, and that's a reason why a lot of people choose Medicare, original Medicare over Medicare Advantage. The other right, which is interesting, is that you have the right to buy a Medicare supplement plan. But there's a caveat, only at certain times. So you do have to, there's actually a guide, and we've done a couple of videos on this about when you can buy guaranteed issue. And mostly when you turn 65 or initially enroll, your initial enrollment, or you're losing group coverage coming off a group, or enrolling, in Part B is the other time. But you do have that right to buy a supplement. There's more for the original Medicare, original Medicare, but let's move on to Medicare Advantage, because these are becoming very popular. There's a lot of people that are choosing that. And this is managed care. This is Medicare Part C. That ends up being your primary. So it's a PPO or HMO. There's a group of doctors, but you still have the right to choose the provider that participates, okay? And you also have the right to know how your doctor is paid. So you can ask the plan that you're enrolled in, Humana, Aetna, Blue Cross, whomever it happens to be, how is my doctor paid? And they are supposed to tell you. So that is one of the rights. And of course, under this plan, you have the right to appeal a claim or file a complaint as well. That's kind of a common right across the board with a lot of these different categories. Last but not least, we have the standalone drug card, PDP, prescription drug plan. That's what it stands for. But it's Medicare Part D. What are your rights? Well, one of the most important rights is your right to keep your personal information, including all the list of your medications and the dosage, private. And so this cannot be, this is your own private information. So that is, you are protected under the laws. You also have the right to file appeals and claims. And what's interesting is they have set up, and a lot of people don't know this, a Medicare OMBUDSMAN. And who this is and what this is a person who helps you when you file a claim. So this is made available from the government. Usually they work with state and local agencies to provide somebody local. But if you want information and a free guide on all of this that I've gone over, we're going to provide you a button that you can click and just provide some basic information, and we will send you, it's called Medicare Rights and Protections, and it's a booklet that's provided by CMS. They actually publish this, and it provides phone numbers, website addresses of different local government agencies that you can contact, as well as how to find an ombudsman if you're going to file a complaint. So if you would like this document for free, please click the little button at the end of this. And until next time, we hope you enjoyed this. Don't forget to tell your family and friends. Give us a thumbs up. And this is Kathy Bukowski, the owner of CB Health Insurance. Thanks for watching.